All right, this has been weighing on my mind, so we're going to talk about it, even though I'm not prepared to talk about it. I don't have anything set up. I don't have any outline, nothing prepared. It's an important topic. Let's get into it. Alcohol and bariatric surgery. The subject of this video is why I chose to give up alcohol even before I was required to, considering that I'm getting bariatric surgery. When I mention bariatric surgery, what I'm really referring to is either the gastric sleeve surgery or gastric bypass. Both of those procedures were offered to me and I chose gastric sleeve, and those two subjects are what I have the most information on. So if you are getting a different type of weight loss surgery or considering a different type of weight loss surgery, you might need to modify what I'm saying a little bit, but I think in general these concepts apply. First, what I want to do is talk about transfer addiction, then what happens to the body that's in the way that it processes alcohol after surgery. Then I'll say why I chose to not drink anymore. Then I want to talk about my history with alcohol. And then I want to clarify alcohol abuse versus alcohol dependency. So there's a lot to talk about. These ideas have been floating around in my mind and I need to get them out of my brain so that I can focus on other things in my life. So, okay, what did I say I was going to talk about first? Transfer addiction. So think about if you have a problematic relationship with food, and let's just say you have a food addiction of some sort. It could be a number of different ways of problematic eating. I'm sure that if you're watching this video, you have a bit of information about that. So your eating is problematic and you're using food to cope, okay? You've decided that you're going to have surgery. You get all the way through, you jump through all of the hoops that you need to do to get that, following the directions of your bariatric program and your insurance company. Those two topics I will talk about in most of my videos. You've jumped through all of those hoops. Then you have the surgery and you had a problematic relationship with food. You were addicted in some way related to food. Okay, you don't have enough room in your stomach initially. You can stretch your stomach out again over time. But initially you're not going to be able to engage in the behavior that you did before. You don't want to anyway, right? But if you don't have things sorted, transfer addiction can happen where you can't binge on food like you used to, but you can certainly binge on alcohol because you need less of it, right? So transfer addiction is a big thing with bariatric surgery. In fact, in the program that I'm enrolled in, one of the doctors told me that there were a couple people that she knew of who got DUIs because they had no idea how alcohol was going to affect them post-surgery, and they hardly had anything to drink and they blew over the limit. So that can happen. Transfer addiction's a real thing and that's a risk. Now, I'll give you a very basic, simple description of how our bodies are different in terms of processing alcohol after surgery. Our stomachs, or whatever intestinal system you have going on, because it's different with sleeve versus bypass, whatever your body does to process food, that's busy, right? There's less room and it's busy. And then your liver is also really busy. So your body's going to break down alcohol differently. It's going to take a lot less to impact you. So the way that I feel is everything that I consume post-surgery counts. I need to be able to get enough protein, I need to be able to get enough water, and I need to be able to absorb the nutrients from my food. I will have to take supplements for the rest of my life. I am going to be very busy just sustaining myself. It will be a job to make sure that I get enough of what I need in the space of time that I have, or in the space that I have to do it with, right? So everything that I eat counts. That's one reason not to drink alcohol, in addition to the fact that I'm gonna process it differently. And so that's a really good summary of why I'm not going to. Those two reasons, the risk of transfer addiction and the fact that it's just not going to process the same. Now, briefly, I want to talk about my history with alcohol. Although I wouldn't classify myself as an alcoholic, and I don't like that term anyway. That's a problematic term. I'll get into that. But while I don't classify myself as an alcoholic, I can tell you that I was very much at risk for it. My drink of choice was red wine, and I only needed a couple of sips to feel a buzz from it. If I had a complete glass of it, I was completely buzzed. And then if I had 2 glasses, not functioning in any kind of adult way, right? Not responsible at all. I don't think it would have been reasonable for me to drive after 2 glasses, and probably not even 1 glass. So that particular beverage worries me. I didn't like any other beverage the way that I did red wine. A beer didn't hit me the same. And like red wine would make me feel very euphoric very quickly. Like I was very loving and euphoric, and it definitely impacted me in a strong way. So if you can think of, like, if I went through a lot of stress and I couldn't cope with food anymore, how easy would it be to develop a problem with red wine? Okay. And then the other drink that I did kind of like was vodka with cranberry juice. And that hit me very differently. So although I probably only had a few a year, that had the potential to make me kind of angry. So I've had enough experience to know that I could be at risk for alcoholism, right? Okay. So that's like a third reason not to drink alcohol. Once I figured out how negative alcohol could be, how negative, see, I'm not rehearsed at all. That's why I'm so awkward, but I still want to get this information out. Once I realized how negatively alcohol could impact me post-surgery, I just decided to never drink again and to not look back. And it's been months and months and months. Maybe it's been a year, but it's definitely been 6 months since I've had any alcohol. So I have a background in psychology. Before I stayed home with my kids, I was a therapist. I have a master's degree in psychology. At that time, I was called a limited licensed psychologist. And what that meant was a master's degree in psychology. I was licensed. I worked under a group practice. So I'm kind of to a full licensed psychologist what a physician's assistant would be to a full doctor, if that makes sense. So I have some training in this. When a psychologist or a psychiatrist is dealing with diagnosing a problem with alcohol, what they look at is alcohol dependency and alcohol abuse. Now, you could have both, or you could have just one of those. So alcohol dependency means that you drink a lot, and like when you stop drinking, you have bad symptoms, okay? So think about what you've heard about or what you do experience. If you have a problem with drinking and then you stop drinking, you experience withdrawal. So if you are dependent on alcohol, if you stop drinking it, you experience some bad symptoms. Now, with alcohol abuse, maybe you don't drink all the time, but every time you do, it causes a problem. You get yourself into trouble in some way. Now, maybe a person could have both. You could be both dependent on alcohol and abuse it. Or you could just abuse it, right? So maybe you don't drink all the time, but when you do, you get yourself into trouble. So yeah, I don't know. That's what I think of when I think of alcoholism. So yeah, I've just decided that there's no room for it. It's not healthy. It's toxic. It causes problems. There's risk for transfer addiction. You need the room in your body to absorb all of the nutrients that you need. That's basically it. So that's why, even though maybe a year to a year and a half after your surgery, your body can better tolerate alcohol, and I'm sure that someone in the comment section could say, hey, I can have a couple drinks. That's fine. If you're on the fence about it, or it's something that you're considering, I want you to be aware of all of these different things and just give it a thought. You're about to do a very life-altering surgery, and you want to make the most of it, right? So think about how that can also impact your social interactions. Who do you spend time with? What do you do when you spend time with them? How are you going to manage in those environments? I think there are a lot of people who feel self-conscious about drinking when they're with someone who doesn't drink. I've absolutely experienced that. You know, I used to have a glass of red wine when we go out, and now I'm drinking water, and like, what's the matter? Why don't you want a glass of wine? Are you judging me for drinking? No, that kind of thing. I keep looking around in case there are neighbors out. But anyway, please leave your comments below if you are also on this journey of pre or post-op with bariatric surgery. What do you think about this? Anyway, thanks for watching. Bye.